Hello and welcome to my channel. My name is Judare Holome. I'm currently a final year medical student living in Nigeria. In this channel, I make videos about medicine, lifestyle, and motivation. It's good to have you here. So in today's video, I'll be telling you the difference between doctors, what are the two main criteria with which doctors are classed. Well, this is the question I hope to answer with this video. 1. Are all doctors the same? If no, on what basics are they classified or are they different? So before we go further, I'd like to share this story with you. In case you are watching outside of Nigeria or outside of Africa, in Nigeria we respect hierarchy a lot. We have respect for our senior colleagues. So there was this thing that happened in a teaching hospital. A man came to the hospital. He was not attended to on time. He was infuriated. In fact, he started shouting at the consultant, the senior doctor on ground. Do you know who I am? My son is a doctor. My son is a doctor. In fact, I'm going to call my son. Guess what he did? He actually called his son. And when his son came, he was hoping that his son was going to take it up and probably challenge those people that refused to attend to him on time. But his son was just a house officer. The thing here is that a house officer is like the least hierarchy of doctors in the hospital. Okay, so now let's talk about the hierarchy. The hierarchy talks about from the apex down to the base, or from the base up to the apex. So what are the different stages in medical training, and what is the apex of medical training? Okay, the apex of medical training is the consultant. That's like the highest point. When you become a specialist in a particular field, you have reached the apex of your training. Though you can also decide to go and do another residency and become a specialist, like get double certified, maybe in another field. In the hierarchy of medical training, the lowest is the house officer. Once you graduate from medical school and you get awarded your MBBS, you automatically become a house officer, and you need to do your housemanship or internship. House officer is just another word for a medical internship. So you need to do your medical internship before you can have your license to practice. Like I said in one of my previous videos, that in this part of the world, the internship or housemanship is just a means whereby fresh medical graduates get to solidify their skills, get to consolidate on their clinical skills and acumen that they learn during the clinical years before they can further be allowed to practice as medical officers. So the lowest ranking in the medical space is the house officer. As a house officer, you're like the lowest ranked doctor, and you're only a house officer for just a year, as long as for now, as at the time of making this video though. And when you're done with your house job or your internship, you automatically become certified as a medical officer. So that's the second strata. You become certified as a medical officer once you're done with your house job. As a medical officer, you are not a specialist. You are just like a general practitioner, and you can either continue practicing like that, which is not advisable, or you choose to specialize in a particular field. And to do that, you have to write your primaries and get into residency. Residency is a program whereby medical officers undergo a series of training in a teaching hospital to become a specialist in a particular medical field. And this training averages about 4.5 years. That's 4.5 years. In Nigeria, from 4 years to 8 years, depending on the particular specialty you choose. The next on the strata is the resident or the junior resident. The resident or the junior resident is someone that has passed his primaries, he has gotten into the residency program and is undergoing residency. So this usually is the first 2 or 3 years of your residency training, of your residency program. To leave that level of being a junior registrar, you need to take an exam. It's a standard board exam, and once you pass that exam, you're going to go to the next phase of your training, which is the senior registrar level. So that's the next strata. You become the senior registrar. From junior registrar, you become the senior registrar. from being a senior registrar, after you pass your final residency exam, which is a standard board exam, you become a fellow. A fellow is just a newly certified consultant in a medical specialty. Then you become a consultant, and that's the apex of your training. Though with time you can become a professor of medicine or professor of surgery depending on your specialty, but that's just mainly the strata that you go through to become a consultant in Nigeria. Just to clarify this, during your residency years, when you are in the process of becoming a consultant, when you are specializing, you're actually doing this in a teaching hospital, in a recognized teaching hospital. You are doing this residency under recognized consultants that are authorized to teach other, to groom other specialists. And you are not just doing this for free, you are getting paid, because actually you are working as you are learning. Yeah, you work and you learn. There's no other way, sadly. So yeah, you work and you learn and you also earn. That's just the good thing about residency. Though the money is not that big, but it's fair, I think, depending on how greedy you are. Sorry I used that word. So yeah, but it will interest you to know that between these two extremes, the extreme of the consultant and the other extreme, the medical officer, between these two extremes are years of committed hours in the hospital. Especially most fields are more rigorous than others. Most, you don't have a time for yourself, you don't have a time for your life, you have to give up almost every other thing. And also you have tons of books and learning materials to consume during this period. A lot of skills you need to learn, and you have to apply yourself to become good at the end of the day. Yeah, they just took the light. That's one of the sad part of living in a third world country, but it's fine. I'm used to it. So the next point on, or the next basis on which doctors are classified, is the specialty. Apart from the hierarchy, the specialty. And there's this misconception that every doctor is a surgeon. In fact, most people will almost not believe that you are a doctor if you tell them that you don't go to the operating room, you don't carry out surgeries. There's this misconception in quote in society that every doctor is a surgeon. Why every surgeon is a doctor? Not every doctor is a surgeon. So now let's talk about specialty. But before we go further, I have a gist for you. Okay, in this week I finished my special posting. Like I said earlier on, I'm a final year medical student. So in this week, I finished my special posting. In Nigeria medical schools, we have what we call special posting. These are some sub-specialty that are not, that in the past were not being given preference to, but now because of their relevance, there's a way to make up for that lapses, and that's why they created this special posting. And I did 5 major sub-specialties. I did radiology, ophthalmology, I did otorhinolaryngology, that's ENT, ear, nose, and throat. I did dermatology and also did anesthesiology. And I'm excited to tell you that during this posting, I was thrilled because I learned a lot of things. But the highlight of the moment for me was anesthesiology posting. I really fell in love with anesthesiology. Am I going to specialize in anesthesiology? Well, I'm not saying a definite yes, but I might, because so far it's the best, it's the coolest, it's chillest. I love anesthesiology for my personal reasons though. Okay, broadly, doctors are classed into 2 types. We have the physicians, then we have the surgeons. Though there are other specialties, especially that are 21st century relevant, but in a broad sense, these are the 2 major classifications of doctors: the physicians and the surgeons. Physicians are doctors that don't operate or that don't participate in surgical operations that takes place in the theater, in the operating rooms. While surgeons, on the other hand, are those that primarily work in the operating rooms and carry out surgeries on patients. And even within these 2 broad classifications, there are many other specialty. For instance, for physicians, we have internal medicine, and under internal medicine, that's where you have a lot of specialty like gastroenterology, we have nephrology, we have endocrinology, a lot of them. While for surgery, we also have a lot of subspecialty in surgery, like the neurosurgery, the general surgeon. So in summary, doctors are classified generally based on two criteria: hierarchy and also specialty. And all doctors are not equal. The next time you walk into a teaching hospital in Nigeria, there are different kind of doctors you are likely to meet. The first one being the house officer, the second being the medical officer, the third being the junior registrar, the fourth being the senior registrar, and the fifth being the consultant. So all these are, whereas they are all doctors, they are not equal, they are not the same. They are in different phases of their medical training or their medical training, yeah. And also, in the same teaching hospital, the different kind of doctors you also meet based on specialty. You might meet a surgeon, you might meet a physician, and the surgeon you meet, not all surgeons are even the same. You might meet a neurosurgeon or a general surgeon or a plastic surgeon. And for the physician, it might be a cardiologist, a nephrologist, or even an endocrinologist. So they are actually very, very different. So have this at the back of your mind the next time you walk into a teaching hospital. Hope you enjoyed this video. Please help me like this video. Please help me like this video and drop your comments. And also share this video with your friends. And if you have not subscribed to my channel, please kindly do so. In my next video, I'll be doing something a bit different from medicine. I'll be doing something on lifestyle. So watch out for that on this space. It was nice having you. Do have a blessed day. Bye.